This presentation is intended as a primer on neonatal thermoregulation, especially as it pertains to achieving euthermia in the delivery room or operating room setting. The overall aim of the on-site practice-wide QI project on neonatal thermoregulation is to increase the number of NICU infants with admission temperatures in the normal range of 36.5 to 37.5 degrees Celsius by 10%. The purpose of this project relates to the idea that normal temperatures, starting at birth, are necessary for optimal physiologic function in premature neonates. Achieving euthermia in the neonatal population relates to the concept of the neutral thermal environment, or NTE. The NTE is considered the temperature range that is associated with optimal physiologic function in newborns. At birth, this temperature range can be quite narrow, though it expands with increasing age. Charts are available that demonstrate the NTE based on gestational age and/or day of life. The concept of NTE relates to the idea of avoidance of excessive metabolic stress associated with a baby's needs for heat regulation. In other words, a baby maintained in their NTE exerts less physiologic function solely dealing with their temperature. Furthermore, maintenance within the neutral thermal environment has been associated with improved outcomes, including respiratory, feeding, infectious, neurologic, fluid and electrolytes, and overall mortality. In the delivery room setting and upon admission to the NICU, the temperature range of 36.5 to 37.5 degrees Celsius is generally accepted as always appropriate for all neonates. One of the goals of maintaining a newborn within its neutral thermal environment is avoidance of hypothermia. The effects of hypothermia begin right at the time of birth in the neonatal population and are associated with a range of morbidities and mortality which are presented on this slide. Some of these include respiratory distress, hypoxia, fluid and electrolyte disturbances including hyperkalemia, hypocalcemia, metabolic acidosis, and hypoglycemia, renal dysfunction, coagulopathy, and the combined effects, including vasoconstrictive and vasodilatory effects on individual organs. In the following slides, we'll review specific heat loss mechanisms that are known to take place in the neonatal population at the time of birth. These are specifically conduction, convection, evaporation, and radiation. We've developed a checklist associated with our QI project that seeks to avoid heat loss through these four different mechanisms. Heat loss due to conduction occurs when a warmer object comes into contact with a colder surface. In this form of heat loss, a warm baby can lose body temperature to a cold surface it comes into contact with. Heat loss via conduction is best prevented through the use of warm blankets, a warm hat, or for our smaller premature neonates less than 30 weeks gestational age, use of a chemical thermal mattress. Heat loss due to convection occurs when a warmer baby is exposed to cooler air currents. This heat loss occurs via another gradient mechanism allowing heat movement from a warmer baby to cooler flowing air. Prevention of heat loss through convection occurs in both external and internal mechanisms. External mechanisms include using the side walls of the radiant warmer to prevent air currents from passing directly over the baby, and also using a warm hat and swaddling in warm blankets to further protect the baby against air currents. Internally, convective heat loss is also prevented by the use of warmed respiratory gases to decrease the gradient for heat loss to occur. One of the most important mechanisms of heat loss in the neonatal population is due to evaporation, which relates to the physical property of cooling that occurs during the conversion of liquid water to water vapor. Heat loss due to evaporation is best prevented by the use of a plastic wrap in our premature population or via rapid drying unless a plastic wrap is being used. Finally, heat loss due to radiation is an osmosis of heat from a warmer baby to a colder ambient environment. Heat loss due to radiation is best prevented by warming the delivery or operating room to a recommended 75 degrees Fahrenheit. It is also avoided by warm hat placement and use of servo mode on our radiant warmers to avoid overheating and thus to decrease the baby to environment temperature gradient. In addition to this educational presentation, the main intervention for our QI project on thermoregulation will be distribution of the checklist shown here, which is to be completed for all infants admitted to the NICU to ensure appropriate heat loss prevention strategies are being used in the delivery and operating rooms.